Okay, good morning, everyone. Always me with my technical difficulties. So I'm really excited to be speaking with you this morning, especially because it is National Infertility Awareness Week here in Canada, or Canadian Infertility Awareness Week. So it's a really important week to be focusing especially on the topic that we're going to discuss today, which is mindfulness and the importance of that when it comes to trying to conceive. So I've received quite a few questions. I'm going to speak to those today. But please, if you have any questions of your own, please write them into the comment section below. I have put a link at the very top of the page, which is to the preconception challenge that I'm running right now. It's totally free. We have about 80 women doing the challenge right now. It's so great. The community is awesome. So please come along and join. So I am Dr. Rachel Corradetti-Sargent. I am a naturopathic doctor practicing with Conceive Health at Niagara Fertility here in Stony Creek, where I live. Fertility clinics are closed right now, as everyone knows, but we're working online with our patients to optimize their preconception care. And one element of that is working on their mindfulness. So I'm speaking today to both Instagram and Facebook. If you are joining me on the replay, just hit me with a hashtag replay. Let me know when you're listening from, where you're listening from when you have a moment. I've gotten a lot of comments from people listening from all over Canada and into the US, so that's awesome. I may not be able to work with you personally, but I can always give you the name of someone who can. So first and foremost, why did I start meditating and journaling? Because oftentimes we are brought to this avenue of healing for some reason. So in my particular case, it came into my life in 2015 when I had an ectopic pregnancy. This sent me down a major path of healing that involved really getting engaged with journaling for sure. I actually brought this out today to show you that I still have the journal and the letter that I wrote after I had my ectopic pregnancy and the journey that I went through after that. So I always hold on to that. It holds a special place in my heart for sure. So even just beyond that, though, I've had a lot of traumatic events in my life. You know, a lot of people do. I've had a lot of close family members pass away. I dealt pretty intensely with postpartum anxiety after my daughter was born. And anxiety is something that I have to manage on a regular basis. So I find meditation and journaling in particular are really important for me. So why are they important for, the entire trying to conceive community or for fertility in general? Well, we know that stress can delay the time to pregnancy. So some of the information I shared in my preconception challenge group this week is that at this point, we don't have a direct link research-wise between stress causing infertility, but we do know that it can delay time to pregnancy, and it poses an increased risk for infertility. And then we also know on the other side of that mindfulness techniques of many different kinds can improve the outcomes of advanced reproductive technology. So if you are someone who is going through IUI, IVF, then we know that mindfulness can be very beneficial for those procedures and for the results of those procedures. So what types of options are out there? Because there are so many, and everyone thinks, okay, I'll just go sit in a room and I'll be quiet and I will just, turn my brain off. Well, that doesn't always work for everyone. I can tell you it definitely did not work for me. So there are many different ways. So journaling is definitely something that you can get into, and some people can just free write. And if you can do that, that's great. I don't excel at that personally. I always need a little bit of a push for what to be focusing on, but sometimes I can let it flow. Gratitude practicing is also another awesome one. So I actually will show you my journal, which kind of looks a little bit messy, but I use the 5-minute journal. I've been using it for a long time. One of my girlfriends got it for me as a birthday present, and I've just been getting a new one and using it ever since. So it allows you to actually take a minute each day, and in the morning, it encourages morning, and in the evening, in the morning time, it asks you to write about things that you're grateful for, as well as sort of your intentions for the day and any affirmations. So it really focuses on quite a few awesome ways to get started with your day. And then it also asks you to sum up your day at the end to just discuss some great things that happened for you in that day. So it really helps you stay positive and stay focused. I know it can be easy for us to focus on the negative, so that really shifts your mind. Affirmations, as I mentioned, are something that is another great thing to do. There are lots of very fertility specific options out there. So Circle and Bloom is something that I recommend to patients all the time. I use Circle and Bloom recordings during my acupuncture sessions when I'm in the clinic doing acupuncture, which we're not doing right now, of course, because we're all working from home. But Circle and Bloom has some great programs that involve affirmations and visualizations, because visualizations are really powerful when it comes to fertility in particular. Competitive athletes use visualization when they're preparing for big events, and the research there shows that the outcomes are extremely powerful. And the same thing goes for fertility, the fertility side of things too. So really focusing your mind on what you want your body to be doing. Yin yoga is fantastic, deep breathing, mantras. Honestly, I've tried all of these things. And so generally what I encourage my patients to do is to find something that works for them. So you're not going to stick to it if it's not something that resonates with you. So for me, mantras didn't really resonate with me. So it's not something that I stuck with, but I've been able to really stick with meditation. I've been able to stick with journaling. That works for me. The other thing that's really important is to find, time in your day when you can actually do this. And so for me, in my case, it means that I actually schedule time to do it. I actually have like a block in my calendar where I say, okay, this is when I'd like this to happen. It doesn't happen every day, but at least it's there. At least I've thought about it ahead of time, and I know that I want this to be part of my daily routine, because it's essentially, as Marie Forleo says, if any of you are followers of her, you'll know this, she talks about non-negotiables. So there are certain non-negotiable things that have to be, done in my day so that I feel like my cup is full instead of half empty. So the other, as soon as though it starts to feel like work or another thing to do on your to-do list, then maybe, there needs to be a little switch or something like that. The other thing I hear a lot, and this question came up for sure when I was posing, this talk out there, is, what if I'm not good at it, right? So what if I'm not good at meditation? Well, it's not really something to be good at. And Art from the Heart, I totally see your question. I'm definitely going to answer that in just a sec. Thanks for it. You don't have to be good at meditation. You don't have to be able to sit there and turn your brain off and nothing happens. Andy Puttycombe, who is the founder of Headspace, has a fantastic reference for this. He has a video actually where he explains, that the idea is to imagine that you're basically sitting on the side of the road and watching a really busy road full of traffic. And as you're watching the cars go by, most of us have a tendency to jump out into traffic and try to control the situation. It kind of feels like what we're dealing with right now, right? Like everything's a little bit out of our control. And we want to jump out and try to control whatever we can. So the idea with meditation is, how about we just stand at the side of the road and we watch the cars go by? And that's what we kind of want to focus our attention on, is rather than trying out to jump and control it, can we sit back and watch the cars go by? And imagine that with your mind. If you're jumping into your head all the time and trying to control your thoughts, it's not necessarily helpful for staying calm and present and mindful. If you're able to just, understand that the thoughts are there and be observant and aware of them, as opposed to trying to control them, that's where we start to get a really good practice going. So it's not about trying to turn your brain off at all. It's about just being aware of those thoughts. So please let me know if you have other questions. So Art from the Heart, your question is, what is the oldest woman you have helped conceive naturally? The issue with COVID-19 has delayed life for everyone. Yes, what's going on with this situation with COVID-19 is awful. I mean, and this week being National Infertility Awareness Week, it just makes it so much more present for everyone. Yes, it's awful that, this trying to conceive, all of the fertility clinics being closed. We're not able to do this. It's incredibly stressful, and having no control over the timing or knowing when these things are going to resume again. It's awful. And so I'm so sorry. I really do hold space for everyone going through this, because it's just a terrible experience. In terms of the oldest, gosh, that's a really good question. And off the top of my head, I want to say 38. I have one particular patient in mind who I'm trying to remember her exact age and I can't, but I think it's around 38. So yeah, it's, as you're saying, art from the heart. It's so unfortunate, and trying at home in the event. Yeah, it's we talked about this a little bit a couple weeks ago, where trying to conceive at home naturally at this time, is it a good idea? There are, still to this day, we don't have, this is so new, all of this is so new, we don't have a lot of information on the safety of becoming pregnant right now. So like I said, I hold space for everyone right now who is finding this situation just totally unbearable from a fertility perspective. It's really awful. That's where a technique like mindfulness might be really helpful, to help you work through a lot of the thoughts and feelings that are coming up, so that they don't stay stuck inside, where they're going to drive you crazy, crazier than we're all feeling right now, right? So if you have any other questions, please send them below. I'm happy to answer. And if I don't see any coming in the next few seconds here, we'll sign off for the rest of the morning. And I want to thank you so much for joining me this morning. Once again, if you're able to join in with the preconception challenge, even though we're heading into the final week next week, the information's there and it will be sent to you, so you'll be able to participate really at any time. We have an awesome Facebook page, private group where we're having some good discussions too. So thanks to everyone who's participating. Once again, I'm Dr. Rachel Corradetti Sargent. I'm a naturopathic doctor who's fertility focused. I practice at Niagara Fertility in Stony Creek, and it's been awesome to see you all this morning. Okay, take care. Bye.